Hey guys, it's Justine Buick from the NCLEXtutor.com and Co-Opine Tutoring and Test Prep, where we help nursing students pass the NCLEX and their other nursing exams through private tutoring. So today I'm going to be talking about one of the new types of NCLEX questions. It's called a bow tie, and I'm going to go through one and show you how to answer it. The NCLEX now has all these new types of questions on them, and there's standalone questions and then there's these case studies. So today we're going to be talking about a standalone bow tie question. So this is probably one of the more common types of standalone questions on the NCLEX, where they give you a patient scenario and then you have one question that you have to answer, but it's a little bit more complicated than just a regular multiple choice type of question. And a lot of our students are getting these types of questions on the NCLEX and they're doing really well with them. They can seem a little bit complicated, so you do want to know how to actually answer these questions. And so it actually looks like this. It looks like a bow tie, where you have the bow tie part in the middle and then if the two answers that flare off to the left and the right. And this question has 5 answers total. And if you do pick a wrong answer, you don't get a point taken off. So you would just get a 0 for that. When I do these bow tie questions, I actually always start in the middle and try to figure out what is the potential condition or the medical problem that they're having. And what they do is they're going to give you a scenario. So either health history, nurse's notes, or vital signs, and maybe some labs. And as you're reading the data, that assessment data, I want you to try to figure out what is the medical problem here. Because every one of these questions is some kind of problem that they want you to try to figure out what it is, and then what are you going to do about it. So let's read it. The nurse is caring for a 67-year-old client in the cardiac care unit. So I like to see the age and the gender of my patient. It just helps me visualize. Is this a really young person? Is this an older person? And then what's my setting? What kind of floor am I on, or what kind of nurse am I? So I'm on a cardiac care unit. So I know that potentially this could be a cardiac issue. So as I read the nurse's notes, look for the things that are abnormal, okay? I'm actually going to highlight some of the things that I see as abnormal as I read this question. So it's 15:30, so 3:30 in the afternoon. Client admitted 2 days ago for a scheduled coronary artery bypass graft. So you want to know what that is. I know that's a cardiac procedure. Times 2 vessels. No complications during surgery and recovered in the ICU overnight. So far, so good. Client transferred out of the ICU this morning to the cardiac care unit. Okay, so they're getting better. History of coronary artery disease. So just make sure this makes sense as you're reading it. Makes sense they would have coronary artery disease and then have to get a CABG. Hypertension, hyperlipidemia, and osteoporosis. Assessment findings are as follows. So as soon as you start to see the assessment findings, get alert, okay? Because this is where you're going to start to see the problems with the patient. Alert and oriented times 3. Denies shortness of breath, sore throat, or cough. Lungs clear bilaterally. Irregular heart rhythm auscultated. Ooh, that's not normal. You shouldn't just have a irregular heart rhythm. Denies chest pain. Skin is warm to touch, cap refill less than 3 seconds, no edema, and peripheral pulses 2+ and equal bilaterally. So the rest of that stuff looks okay. So you have to be detailed oriented. Don't just skim over stuff. I mean, really pay attention to each assessment finding and see if it seems normal or abnormal. Denies nausea and vomiting, bowel sounds active times 4 quadrants. Reports passing flatus, and the last bowel movement was morning of surgery. And remember, that was 2 days ago. So they haven't had a bowel movement in 2 days, that's okay. Indwelling Foley catheter was discontinued this morning and has been voiding clear yellow urine without complications. Up to bathroom 2 times with assistance. The gait is steady. Client is currently sitting at the bedside and reporting a racing heartbeat. Oh, not good. And feeling faint. Not good either, right? That's not normal. Vital signs are heart rate 142, That's very high, right? What's normal? 60 to 100. Blood pressure is 116/78. That's fine. Respirations are 18. Pulse ox is 96% on room air. And the temperature is 98.4. So all of that is good for the rest of the vital signs, except for that high heart rate. So what are some of the things that you see that are abnormal? Well, there was an irregular heart rhythm that kind of goes with the racing heartbeat. And if they have a really fast heartbeat, they may not be getting great cardiac output. So it might make them feel faint. So all of that assessment data sort of all goes together. It's kind of all linked together. So that's a strategy that I actually use. When I see things that are very similar, I sort of put all those things together. So now that you have that assessment data, do you have any idea what that medical problem could be? What could be that complication that they're having? Obviously, it's something cardiac, right? So you may not be able to say what it is, and that's okay. But as long as you can recognize, yes, there is something wrong here, you're just more likely to get more answers correct. So now here's the question. Complete the diagram by selecting from the choices below to specify which potential condition the client is most likely experiencing. So that's the middle part. 2 actions the nurse takes to address that condition. So you're going to pick 2 answers here. And then 2 parameters the nurse monitors to assess the client's progress. So I start in the middle always. What is that potential condition? What could it be? And then you're going to drag that answer into the center. And then what would be 2 interventions that you would choose to address that problem? And then what would be some things that you would be assessing or evaluating for that condition? So let's go through them one by one. Is it atrial fibrillation? So obviously you have to know what these conditions are. What is AFib? It's when the top of the heart kind of shakes a little bit. It doesn't really pump very well. What would be some of those signs and symptoms of AFib? So you have to know what is the cause, the patho, and then the signs and symptoms of that condition in order to be able to choose an answer. So you have to know that content. Now, when I'm not sure about AFib, so I'm just going to question it, but it is a heart problem, and it sounds like they're having a heart issue. Remember, what did they have? They had a high heart rate. They had an irregular heart rhythm, was auscultated. They are feeling faint, and then they have a racing heartbeat. And I want you to know too that you can always go back to those notes if you need to. Abdominal aortic aneurysm. So that is when they have the weakened vessel wall in the aorta and their abdomen. And those symptoms are not the same as these symptoms. Usually they can have some back pain. And so it's not even cardiac. So I don't think they're having that. It's not even a complication I would think of after a CABG. Ventricular tachycardia, that's another heart dysrhythmia. And what is that one? That's when the ventricles beat really, really fast. It looks like this. We call them tombstones on the EKG monitor. Tombstones, because if you see that, it's very likely that your patient is going to be dead or dying because it's horrible. But you have to know that, right? You have to know that sign and symptom data in order to take that as an answer. I'm going to just keep it in though. Pneumonia. What is that? That's an infection in the lung. They get low oxygen, increased respiratory rate. They didn't have any of that. So that's definitely out of the question here. So it's going to be between these 2. Now, how do you choose your answer? Pick the answer that is most specific or most likely what your patient is having. Don't pick answers based on crazy exceptions. So I'm just going to not pick an answer yet, and I'm going to go look at the actions to take because maybe you're not sure. So what would we do for this patient who's having these symptoms? Should we prepare them for immediate cardioversion? So that is when you, what is that? Describe that for me. This is what I ask all my students to do. So that's when they shock the patient and then put them back into a normal sinus rhythm. Do we have enough information to choose that answer? I don't think so. To me, it sounds very extreme, so I'm not loving that answer. Perform a cardiac stress test. So what's that? Describe that for me. That's when they either give them medications or they stick them on a treadmill to increase the workload of the heart, and then they want to see if they can find any dysrhythmias. Well, it sounds like they already are having a dysrhythmia, especially when I look at my answers. Obviously, they're having a dysrhythmia. Is this going to help the patient? No, it's not going to help them. In fact, it'll probably make them worse. So we don't need to do that. A 12 lead EKG. Describe that to me. It's when they stick those wires on the patient and then they get a rhythm strip of what the heart is doing. That is a diagnostic test that gives you more assessment data. I really like that answer because I really don't know exactly what's wrong with this patient. So we're going to keep that one in. Monitor airflow via incentive spirometry. So describe that to me. So that's when they use that incentive spirometer and it helps open up the lungs and we can see how good a breaths that they're getting. You know what? That answer sounds like something that would go with pneumonia. And so they give you these distractor answers that are really good answers, but they're true for some other medical problem. And we don't have a pneumonia problem, so I'm going to get rid of that one. And then prepare for verapamil continuous IV infusion. Uh-oh, I don't know what verapamil is, right? You may be thinking that, oh my gosh, do I give that as a medication? I don't know. So you do want to know what meds are for. It's a very simple strategy. What's the med for? What's the med for? Because if you know what meds are for, it's going to be so much easier to get the right answer, right? So that's just knowing content. So I'm not sure. Let's just question it for right now. But what could it be? Maybe it's some cardiac med that's going to help them with their symptoms, right? That's what they're trying to get at. So now that we sort of have our answers, let's go over to some of that assessment data. What would we monitor? Troponin levels. Well, what are troponin levels? What is that lab for? What does that indicate? So you have to know content. So that lab tells you if the patient is having what? A heart attack or an MI. Are these the symptoms of an MI? Feeling faint, racing heartbeat, irregular heartbeat? It might be, but remember what typically is an MI is that chest pain, or with women, they get this kind of GERD, acid reflux type of feeling. So not really the symptoms for that. So I'm going to get rid of that one. The heart rate. What was their heart rate? It was what, 142? I really like that answer. They said they're feeling like they have a racing heartbeat. So I'm definitely going to keep that one. A chest x-ray. So what, describe that. What would that be for? So remember, these are diagnostic tests. That would be to check if their lungs are all congested, if they have a pneumonia. You can look at a chest x-ray to look at how big the heart is, but that really sounds like a good answer if they had a pneumonia. So I'm not going to pick that one. Neurological status. Okay, so let's see, is that a good answer? What does neurostatus tell you? It tells you if they're getting enough oxygen and blood. And remember, they said they were feeling faint. So to me, that's a really safe answer. I'm going to keep that one. Now, peripheral pulses, so those pulses in the feet, do we need that answer? Were they having an issue with their circulation in their feet? And actually, let's just go back to the notes here about the pulses. It says the peripheral pulses are 2+ and equal bilaterally. It was totally normal. Why am I going to pick something that's totally normal? So just get rid of that one. Now, do you know what the condition is? Is it AFib or VTAC? Well, VTAC, the symptoms are, they're basically passed out, they're non-responsive, and that's not the symptoms of this. So AFib is an irregular heartbeat, and sometimes they feel like they're having a racing heartbeat because it goes really fast and then it goes really slow. So I'm definitely going to go with AFib here. And then the only answer to me that makes sense for a dysrhythmia and having symptoms, I don't want to pick the extreme answer. I don't want to pick an answer or the cardiac stress test that's going to harm them more. So I'm going to go with the medication. Ooh, I might be wrong, but to me it seems like the safest answer. And safety is definitely a big strategy on the NCLEX. And then I have my heart rate and my neuro status to tell me how they're doing. Those are the answers. And if you're not sure what verapamil is, it's a calcium channel blocker. It helps decrease that heart rate and will hopefully put them back into a normal sinus rhythm and help with those symptoms. Well, thanks so much for watching, you guys. I hope you found that helpful. I'm also putting up some videos with the other types of NCLEX questions, like the case studies and a few of the other types, so be on the lookout for that. If you are interested in tutoring, we do have a whole team of tutors that can help. And if you are interested in reviewing content, especially if there were some things that you went over in that practice question and you didn't really know the content, well, the book that I wrote is really good for that, the NCLEX Nursing Nugget Pages. All right, bye.